Professional athletes are prone to lower back strains, which are caused by unilateral twisting motions. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today, we visit with Dr. Rhonda Bacheron, sports medicine orthopedic surgeon and athletic trainer, to tell us more about lower back strains.
The symptoms usually are spasticity, pain, that varies from sharp to a dull ache in the lower back. A more significant injury could be represented by pain going into the buttock region or down into the leg, and that would warrant pursuing an MRI to rule out a pinched nerve or herniated disc. Treatment for a lower back strain usually involves an anti-inflammatory medication to bring down the inflammation of the strain. At times we may use a muscle relaxant to help the spasticity.
The first thing to do is your RICE, right? Rest, ice, compression, elevation, right? To get this tissue calmed down. Low back strain, a very common injury in sports, and it can be actually severe, it could be very minor. The minor low back strain can usually go away with just rest. If it does go away with just rest, before you get back to your sport, you want to try to do some exercises to help prevent it from coming back. There are 3 exercises that we're going to demonstrate. A side bridge, called a side bridge. One is called a single leg bridge, and one is called a prone bridge. He's going to lift his hips off the table. He's going to maintain that position, right, without shaking, without dropping his hip, in a good position, right? Everything's lined up. Your goal is to be able to stay in this position for 60 seconds on this side and then reverse it around for 60 seconds on the other side. And this is a single leg bridge. Lift your hips up off the table. You can put your hands next to you on the table. Hold that position, right? Don't let your hips drop, and straighten out this leg so it's level with this leg, and hold that position. Some people refer to this as the plank or the prone bridge, same thing. And he's, again, up on his toes, as you can see. He's got a nice straight, level spine and back and hip, and he's up on his elbows. If you have a severe low back injury, you'll know it right away because you won't get better with rest, and these exercises that I've shown you will make it worse, more than likely. The best thing to do is go seek out a medical practitioner to make a diagnosis of what's wrong.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.